Hey, beautiful soul. I think when you opt for a hair transplantation, there is one doubt which always remains. What if my hair transplant fails? What if I don't get hair? What if I get some kind of complication? And obviously, you must be having those questions in your mind. So, when you try to get an answer, you try to search for a surgeon who can deal with those sort of complications, who has capability to deal with those sort of complications. I think before going for surgery, you should plan this also. And I'm going to share a case with you. That's my own case, which we did, and there were some kind of complications in the case. Now, when you see these cases, you don't know the real story, real picture behind it, and there are 2, 3 take-home messages from this video, from this case. So I want you to listen to the entire case completely and take that message. So in this case, a dreadful complication called ischemic necrosis happened, and number one point, the surgeon should be able to deal with that complication in case it happens. And second, to deal with that, the surgeon needs to have skills of both the techniques FUT as well as FUE, which is very important. When you see the full video, you will come to know about that. And thirdly, finasteride has not been used as a booster to enhance the results. So please watch the video. I'm your friend Dr. Shaiil Gupta, and the basic reason why we make these videos, when you see the results, you don't actually know what's going on, and something which looks very lucrative even in daylight, but it is actually not. This patient had a very broad forehead, and the frontal thing was kind of gone. There was nothing there, and we did a surgery with a combination technique where we used FUT plus FUE. So you can see the donor area. Then we did a combo, and we did around 3,500 grafts for him. And first, this area was closely packed, densely packed. As you can see in this picture, it looks pretty okay, decent, and but there is slightly bluish or reddish thing which you can see over there. That is ischemic necrosis. So though the packing was done very dense and everything, so what went wrong? So what happens when we are making slits? There are so many blood vessels under the skin. We don't know which blood vessel are we hitting. Obviously, when we make the slit, a lot of blood comes out. That means we are hitting some blood vessels. So when there is mesh of vessels, there is a lot of collateral blood supply in that area. And even if you hit a vessel, cut a vessel, because that area is supplied by a lot of other blood vessels, there is no damage. But in this case of ischemic necrosis, what you are seeing right now, you see, uh, the blood vessel was supplying just one area, and there was only one blood vessel which was supplying that big area. So when you hit it, that area is gone, and then you can see in subsequent pictures there was bluish discoloration. Then there was a wound which took a month, maybe even 1.5 months to heal, and then you can see there was scarring. So though the work was done wonderfully, I mean, entire thing, the packing, etc., everything, but the result did not come. So there was a big scar. You can see the post pictures. There is a hairline though, but the density was even diminished there, and behind that there was no hair growth. Now, such cases are very rare, and they can happen to anyone. So I am like I have experience of around 20 years, but still it happened in my case, and this is not the first time I've seen this. In 3, 4 more cases in my entire career. Now we don't know in which case it happens. It can happen to in your case. So you could be one out of those 10,000, 20,000 patients who can get this. So now that we had a situation in hand, patient was obviously demoralized, and but he was kind enough to understand what happened wrong. We discussed with him, we told him, and obviously if somebody is getting a transplant done, he will obviously get disheartened and with that broken heart. But unfortunately, there was nothing we could do at that time. But yes, when it healed, um we did a repair surgery for this patient. Now, since the first surgery, which was FUT and slight FUE, we had a lot of options. So we did FUE this time because the other donor area was more or less untouched. And since temples and the front was already done, so we had to put behind that. So we did somewhere around 2,700 grafts for him, and you can see the result now. Now this is a amazing transformation which you look at, in this patient. Now another important thing which I would like to mention here, the journey obviously wasn't that smooth, and in this patient, when you are seeing this result, this is around 7-8 months result, and there is no finasteride in this. This patient is applying minoxidil, that is also like around once a week, and 5% minoxidil once a week application. That is it, plus some nutritional supplements, but no finasteride. So in this case, we did not give finasteride, which obviously I did not want to give him. And now the surgery has also been done around 2 years back, 2.5 years back, and he's happy. The growth is still there, and because this was a peculiar pattern of hair loss, and he wasn't really losing hair from these sides, though he lost hair from these sides. As we can see in the pre-pictures, there are miniaturized hair which are present in this portion, and these hair obviously would have responded to finasteride, and the result, whatever you are seeing here, look at the result. If you get softer hair in between, this hairline is going to look stunning and more better and more dense, and everything looks better than what it actually is, and then obviously it sells more. So as far as selling is concerned, there are things, but I did not want to make this patient dependent on the medicine. That was the reason. Now, second thing, usage of donor. Now, we did FUT and FUE first time. Suppose if you choose a clinic which does only FUE, you go to the clinic, you get the surgery done, and if some complication like this occurs, now you have FUE donor maybe like this after one surgery. You see this donor now. If the surgeon to whom this patient actually went, and he does only FUE surgery, what will he do? He cannot help this patient, because if you take out more FUE from this donor now, you cannot get the numbers. You may say you have done whatever numbers, but you cannot get the numbers. So the surgeon has to do FUT in such cases. So hair restoration is a journey. You will have to plan it. Anytime any complication can occur, you have to choose the clinic. Sometimes based on results, because see, the entire criteria when you are choosing a clinic is result. But when you don't know the difference, actual difference between finasteride growth and transplant growth, actual transplant growth, you cannot differentiate. You go to a 30 rupee clinic, you go to a 300 rupee clinic, you go to 3,000 rupee clinic, you go to $3,000 clinic, but it doesn't make any difference. Doesn't make any difference, because at the end of the day, when it boils down to finish it right, finished right, everyone is safe. No difference. Nothing. The only thing which finish it right surgeons need to know is not to be very harsh at hairline, that is it. And then everything looks great. So hair is a journey, and again I request you, even if apparently things look right, you are not going to get it right just once. You want that thing to remain right for a long period of time, and that will happen only when you plan it right. Okay, so getting it right once does not matter. Planning it right for long-term sustenance of result matters, and planning involves correct usage of your toner, your medications, the hairline, techniques, so many things. And I think above all, the intent with which a clinic or surgeon is working, because we are also planning. and every surgeon plans your surgery. But yes, the thing is, whether it is planned for you or for the, what do you call, just as a showcase. So I think this is good, and the reason why we make these videos, why we want you to understand the story, real story behind the results, is to give you that vision, to give you that torch, to give you that light, so that you become wise in choosing the correct solutions, and you don't get mesmerized or maybe bluffed by just finished right business. Okay, thank you. And once again, these glasses, okay, this is finasteride, this is real transplant. I'm giving you this. Please take this and understand and have that vision, clarity of vision. Thank you. Love yourself. Stay blessed.